Hi there, I'm Professor Fragnito, and I wanted to welcome you to Introduction to Trauma-Informed Care and Trauma-Focused Caregiving. So this is a great class. It's all about trauma. So no matter what career path you're going to take, you're going to end up with people that have trauma in front of you. So super important that you learn this, even if you don't want to take like a trauma track or trauma-focused career. Again, you're going to need this. It's everywhere. I see it in my private practice. I used to work at a domestic violence shelter. Of course, I saw it all the time there. At the psychiatric hospitals, trauma is all around us. It shows itself not just in a behavioral health way, like someone's mental health, but also it's stored in our body. It plays out in our relationships. It plays out how we view the world. If a trauma is not processed, it will affect every part of your life. Easy example I can think of is if you had a car crash and you were totally traumatized by it. You could be dreaming about it, having nightmares, afraid to drive a car. Maybe you won't drive a car, or I hear this a lot, you won't ride passenger because you need to be in control of the driving because you're so scared. Or when you're not thinking about it, it just all of a sudden comes to mind and you hear the car crash, the noises in your head, the metal crunching, that kind of stuff. You could have anxiety from that car crash. The anxiety could lead to medical issues, right? You can get irritable bowel syndrome, have acid reflux, migraines, autoimmune disorders definitely are tied to anxiety. Not the full reason for them, but anxiety is there, and anxiety obviously comes from trauma. So it's all around you. So super important for you to take this class if you're going to be in any kind of helping field, a nurse, behavioral health, anything like that. So trauma is one of my specialties as well. I'm certified in EMDR, which is a known modality to help process trauma. I'm also certified in trauma response. I look, when a client comes to my private practice, I sort of look at them through trauma glasses, if you will. I not only do the assessment the first couple sessions, but I ask them about traumas in their life, because maybe they're just coming to me with a boyfriend problem. But then when I do a trauma history, I find that, maybe you had an abusive boyfriend 3 boyfriends ago and you've been terrified since then and you've been having problems since then, or you grew up in a domestic violence home and that's playing out in your relationships, or fear or whatnot. So you can see it comes up everywhere. So super important that you take this class if you're going to be in behavioral health, or again in any helping field. And we're going to focus on some EMDR because it's my favorite thing. And it's amazing. The results are unbelievable. When people really process their trauma, you see lives change, and that's what we're here for, right? Okay. I'm excited to working with you and look forward to it.